Hi, I'm Dr. Jamie West with West Functional Chiropractic, and we're going to be talking about vitamin D today. Vitamin D is one of my top supplements, and it's one that absolutely everyone, 99% of people should be on. There's a few people that shouldn't, but we're not going to get into that here. So, vitamin D, it's the sunlight vitamin. As long as you're getting a good diet and you're outside, good diet, I mean lots of colorful organic fruits and vegetables. As long as you're outside at certain amounts of the day and you're actually absorbing D, you're going to get some, but to be realistic, most people don't get near enough. 90% of people that I test, they're not getting the right amounts of vitamin D. So what does a vitamin D range look like? Well, if we look at medical ranges, like you get your lab paper back, it says normal, yes or no. Those ranges are going to be from 30 to 100. So in the functional wellness world, we want those numbers to be between 60 and 80. And why is that? Well, we know that in that area, the 60 to 80 range, that's where things are functioning almost perfectly. So we're not seeing nasty diseases metastasize, we're seeing immune function ramped up right where it should be. Thyroid health is better. Even anxiety and depression. So all of the mental issues that our world is dealing with in the mental health arena, we're not seeing as much anxiety and depression when our D levels are up, and it's absolutely amazing. A couple of years ago, my husband and I went on a cruise to Bermuda for my best friend's wedding, and I was outside all the time. I get back in the office, and I just felt depressed, and I'd never felt like that. And I got to thinking, and I wasn't getting the vitamin D. I wasn't out in the sun. I wasn't on the boat. I was inside in my office, didn't really have a lot of windows, wasn't getting outside at all. So I ramped up my vitamin D and that went right away. So how much should you take? You have to get tested first. You cannot just go and randomly take D. You have to know where you are. Your doctor has to know how to give it to you. And you have to retest. So I'll put my patients on a high dose with vitamin K2 in it to help it be driven into the body more and not just deposited places. And then we retest at 90 days. And we retest until we get them where we want them. And then we can put them on more of a maintenance dose. So even patients that feel like they're getting sick, they can ramp up their D. There's a couple of different sources online you can get for how to do that. But it's super important. You definitely have to get tested pre and post. Your doctor has to know how to dose it for you and get a good quality. Don't buy it at the drugstore. Most of the time they have fillers. A lot of times they have soy in them. A lot of times they have like a vegetable formula in it. And the companies that I use, they don't have that at all. So make sure it's good quality. And you'll see a lot of things change when you start using D. So if you like this, click like below, share it with your friends so that they can have the benefit too.